As we continue to cover stories to elevate Black voices, a number of health issues are more prevalent in the Black community. The CDC says African American adults are more likely to skip the doctor's office because of cost. And Black Americans ages 35 to 64 are 50% more likely to have high blood pressure than white Americans. So joining me now is Dr. Reggie Washington, the Chief Medical Officer from Presbyterian St. Luke's and Rocky Mountain Hospital for Children. Tell us first, why do we see these healthcare inequities?
Well, there's several reasons, not just one, for the inequities that you just described. First is genetics. We know that there's a genetic predisposition for African Americans to have high blood pressure, but that's not the whole story. Hypertension is known as the silent killer, meaning often the patient has no symptoms. So if you don't know you have high blood pressure, you obviously won't be trying to treat it. So the first thing is to go to a medical facility and have your blood pressure measured. If it is elevated, there are several things that you must do along with your healthcare provider. For example, we know that good nutrition, eating adequate fruits and vegetables and avoiding excessive salt will help you lower your blood pressure. But also, you need to have your blood pressure continually monitored. You cannot go to a healthcare facility once a year or once every other year to an emergency room for your visit. You must go for well child or well visits, normal physicals, so that you know how you're doing with your blood pressure. And finally, if your physician or healthcare provider has put you on medication, by all means, take your medications. Often people will get a prescription and they either will not get it filled because it's expensive or it's inconvenient to go to a drugstore, but that's all important in treating your blood pressure.
Absolutely. And, a big question is, what is the hospital doing to address inequities?
Well, we do several things. First of all, people like to go to healthcare providers that look and act like them. So we're increasing our minority primary caregivers so that people feel more comfortable getting the care they need. But they also need to have access to health care, and that's beyond the total responsibility of the hospital. We have to do a better job as a country of providing places where people can get their health care. Most people who have no insurance only go to an emergency room to get their health care, and that's probably the worst place to get normal physical exams and well visits.
Absolutely. Access is so important. We know there's a lot of health conditions that are more prevalent in the Black community. Tell us about some of those.
Well, there are a lot of things that contribute to the health dilemmas that African Americans and other people face. We call them the social determinants of health. Where you eat, where you get your groceries, what kind of transportation you have, what kind of home environment you have, all contribute to your medical condition. I'll give you an example. If you go to a physician or a healthcare provider and get a prescription for your high blood pressure medicine or your diabetes medicine, but there's no drugstore nearby, there's no drugstore easily accessible to you, you're less likely to get that prescription filled. If your healthcare provider tells you to eat fruits and vegetables every day, but where you shop for groceries, there are no fresh fruits or vegetables, or they're very expensive, that becomes an issue. So there are multiple things one can do to help their health care. The other thing that I think people need to realize is, regardless of what kind of chronic condition you have, if you smoke cigarettes or you're overweight, those contribute to your health picture. So if you're not paying attention to avoiding tobacco products and you're overweight and not exercising, all of those things contribute to your overall health well-being.
Absolutely. Is there anything we haven't touched on that you want our community to know about?
Yeah, I think one thing that people need to realize is all these chronic diseases travel together, meaning if you smoke cigarettes and you're overweight, you're likely to have diabetes or high blood pressure or chronic kidney disease. We seldom see a patient with just one of those problems. And so we need to treat the whole patient. And that means going to get preventative care. It means keeping up with your medications. It means good nutrition and good physical activity. You can't shortchange any of those.
Absolutely. Well, thank you so much, Dr. Washington. We really appreciate it. And stay with CBS News Colorado for more stories about elevating Black voices.